So today I'll be talking about primary skin lesions. So let's go. So we already know that primary skin lesions are part of the disease process. The most common primary skin lesion is macules. Okay. So macules are these are what? These are non-palpable lesions. Non-palpable, non-palpable, non-palpable lesions. So you can see it, but you cannot palpate it. You cannot make a difference by palpating it. You can see it only by, you can only make difference by seeing it. Very small, it is less than 0.5 centimeter, and some textbooks mention less than 1 centimeter. So either one is true. So macules are simply change in color of skin. Okay? change in change in color of skin. Change in color of skin. So the change may be like hypopigmentation, hypopigmented, that is decreased pigment, as is seen in case of vitiligo, or it may be hyperpigmented macules, as in case of let's say freckles, that is also known as ephelids. Some vascular abnormalities some vascular abnormalities may also result in macules. Coming to the other primary skin lesion, that is patch. So patch is also change in color, but it is more than 0.5 centimeter, or uh, some book says more than 1 centimeter in diameter. So macule was less than 0.5 centimeter, whereas patches are more than 0.5 centimeters. The other one is papule. So papule are palpable lesions. Okay, palpable bumps. Okay, palpable bumps. In case of macule, they were change in color, they were non-palpable, but papule are palpable. They are solid, elevated lesions. They may be as a result of metabolic disorders or dermal infiltrates or localized cellular or hyperplasias in the dermis or epidermis. So papules are palpable bumps, solid, elevated, and they may be as a result of metabolic deposits or dermal infiltrates or localized hyperplasia in the dermis or epidermis. So when we talk about papules, their surface contours matter. For example, some papule may be dome shaped. So dome shaped papules. Usually in case of acne, we can see dome shaped papules, whereas some papules may be pedunculated. Okay, so they have pedicle. Okay, so these are pedunculated papules. Okay, they have pedicle. Okay, and pedunculated papules are seen in case of skin tags or acrocordons. The other variety that we may encounter is verrucous type of pupil. So these are verrucous papules. Verrucous papules. These are seen in warts, warts, or they are also known as verruca vulgaris. Some papules may be umbilicated, umbilicated papules. The typical example of umbilicated papule is molluscum contagiosum. Molluscum contagiosum. Molluscum contagiosum. Some papule may be flat topped, the others may be spiky papules. Okay? So flat top papules are also common, and they may be seen in acne, and acuminate papules. These spiky papules, papules having spikes are called acuminate papules. Are called acuminate papules, and these papules are typically seen in conditions like condyloma acuminata, that is a STD. So this is all about papules. The other second primary lesion is plaque. So papule are solid elevated small lesions less than 0.5 centimeter. Plaques are also solid and elevated. These are also solid and elevated lesions, but they are more than 0.5 centimeter, and some textbook mention more than 1 centimeter. So when papule enlarges, suppose this is a papule, if its horizontal diameter enlarges, that is, it becomes larger with flat base, we call it plaque. And common examples of plaques are like psoriasis, eczema, eczemas, maybe ringworm, that is tinea infections. So these are common plaques. We saw that papule, if a papule, that is the one we discussed, if papules, in case of papules, if a papule enlarges so that its horizontal diameter is longer than vertical diameter, it will be a plaque. But suppose its vertical diameter only enlarges, so the vertical diameter is more than horizontal diameter, so in this case we call it a nodule. So plaques are flat with more horizontal diameter more than vertical diameter, whereas nodules are bumpy, they are taller, and in case of nodules the vertical diameter is more than horizontal diameter. A larger nodule, so a larger nodule may also be known as tumor. In case of tumor, usually if the size is more than 2 centimeter, we call it a tumor. The other primary lesion is a wheal. So wheals are commonly known as hives. Hives. The special character of wheel is that it is evanescent. That is, they are transient. They are due to dermal edema. Which is a result of action reflex. Usually histamine mediated, usually, not always, but usually histamine mediated. So their treatment of choice is antihistamines. So antihistamines are drug of choice. The wheels may have different shapes, like they may be round, oval, or arcuate, even annular. If the wheels are linear, we call them dermographism. Dermographism. So if wheels appear along the line of trauma, we call it dermographisms. Stroking of skin may produce dermographism in some persons. The other thing that needs to be discussed while discussing about wheals is angioedema. Angioedema. So suppose this is skin, epidermis, this is dermis, and this is subcutaneous fat. So dermal edema causes wheal, whereas edema of dermis as well as subcutaneous tissue causes angioedema. Wheals are usually pruritic, whereas angioedema are usually painful. The next primary lesion is a vesicle. So we discussed that papules are solid elevated lesions, whereas vesicles are elevated lesions that contain clear fluid. Remember it, clear fluid. Okay, clear fluid. Vesicles have clear fluid, and size of vesicle is less than 0.5 centimeter. And vesicle may result as a result of, they may form as a result of cleavage of skin that may be at the level of epidermis or dermoepidermal junction. If the vesicles occur as a result of cleavage within epidermis, we call it intraepidermal vesicle. Intraepidermal vesicle. If it occurs below the epidermis, we call it subepidermal vesicle. Subepidermal. So we can see vesicles in case of varicella, that is chickenpox, herpes simplex, as well as zoster. If the vesicle enlarges, it forms bulla. So bulla are elevated lesions that contain clear fluid. and the size of which is more than 1 centimeter or more than 0.5 centimeter. And the lesions in which vesicles and bulla are present, we call them vesiculobullous lesions or vesiculobullous diseases. Coming to pustules. So pustules are circumscribed raised lesions that contain pus. Finally, coming to the telangiectasias. So, telangiectasia are dilatations of superficial cutaneous blood vessels. They usually disappear on application of pressure. Examples of telangiectasia may be seen in case of rosacea on the face. If there is rosacea, we can see telangiectasias around the nose and on the cheeks. Similarly, some primary lesions are formed due to extravasations of RBCs, and they include lesions like petechiae, purpura, and ecchymosis. So, the pinhead lesions are called petechiae. Petechiae are pinhead-sized lesions. Purpura are larger than petechiae and smaller than ecchymosis. And ecchymosis are large bruises. Purpura may be palpable or non-palpable. Palpable purpuras usually result due to vasculitis, whereas non-palpable purpuras are as a result of bleeding or clotting disorder. However, some vasculitis, capillaritis may also result in non-palpable purpura also, but usually vasculitis cause palpable purpura and non-palpable purpura are result of bleeding or clotting disorders. The other primary lesion is hematoma. Hematomas are swellings from gross bleeding. Similarly, comedones are usually formed due to plugging of hair follicle by keratin and lipids. So comedones may be open comedones or closed comedones. Open comedones appears as black heads, and closed comedones appear as white heads on the face. Similarly, other primary lesion is burrow. So burrows are wavy, thread-like tunnel in skin that harbors mite of scabies. Okay, so burrows are wavy thread-like tunnel in skin that harbor the mite of scabies. And lastly, cysts are also primary lesions. So cysts are encapsulated cavities lined by epithelium, lined by true epithelium. So if they are not lined by epithelium or endothelium, we call them pseudocysts, and they usually contain fluid or semi-solid material. The examples of cysts are dermoid cyst, epidermoid cyst, or let's say mucinous cysts. So this is all about primary lesions today. Thank you for being patient.